New Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. I'm Carol Merton, and today I am delighted to welcome to the program Annette Pedlar. Annette is the Executive Director of Safe and Sound. And Annette is here because we'd like to get an update on the programs and services certainly being offered for the unhoused, precariously housed, and for Safe and Sound, what the future holds for Safe and Sound. Annette, thank you for being here today.
Thank you so much for having me. I'm so happy to be here.
Thank you. Well, we've got lots to talk about. And as you and I chatted before, this is going to definitely be a conversational type of interview because I know you've got lots of information and I have a few questions for you.
I hope you do.
So we are taping this program. It will be aired after March 31st, I'm assuming, and that's the end of the overnight program that you've been offering. So I'm wondering if you can fill in for those who may not be aware of what the program has offered, and then what's going to happen. How many have used it, and what have you discovered?
Yeah, totally. Well, so for those who don't know, we received funding through Grey County for the start of November, from November 1st to March 31st, to be operational 24 hours. So if you haven't ever been to Safe and Sound before, we operate a drop-in service at 310 8th Street in Owen Sound, and we offer a wide variety of services to, as you mentioned, people who are homeless, precariously housed, or maybe they're just looking for extra community and supports. So there's a whole lot of different reasons why people come through our door. And they can access things like computers and phones. Washrooms is a big thing with a shower. We also have a free clothing cupboard that people can get any clothing or footwear that they need, coats, hats, mitts. Also free laundry services. And we also have a transitional housing program upstairs. So we have 4 people who live up there. So that's all well and good, except for the fact that every afternoon at about 3 p.m., we would have to close. So we got this funding from the county for just as a pilot project for this past year to extend our warming hours to be 24 hours. So it's been a big, I was going to say 10 months. No. Feels like 10 months. It's been a big 3 or 4 months, and we've been really heartened by the amount of community support, especially from other agencies and from our participants, about how grateful they've been for us to be open for the last several months, and it's been. We've had a real increase in the number of people accessing our service also. And so that's been a lot to manage because we have a pretty small space. So we're consistently seeing around 20 people every night. And so unfortunately, because of our fire code, we can't have people have cots here. So it means instead that it is more of a resting area and a warming area for people rather than a full sleeping shelter for people. And so with that, some of the people aren't here for the whole night. So even though we have an average of 20 people, some people come and go throughout the night, whereas others have been here, the whole time.
So the important thing to note is you are not a shelter.
No. Yeah.
We don't have a shelter in Grey Bruce anywhere?
We have an emergency motel program in Grey County. The county itself runs that program. In Bruce County, it's the Y. And previously, also Mawickwidong had a motel program, but unfortunately, they don't have any funding to continue that. So if somebody is looking the issue is that there's way more people than the total number of motel rooms available. So the county has bought the Diamond Motel, and it has 22 rooms in it. But they have a list of everybody who's homeless in the area, and it's over 200 people in Grey and Bruce.
Oh my goodness.
So 22 rooms, unfortunately, isn't going to really totally give everyone a spot to be at night. So that's where this service comes in to try and help people who can't get into the motel program, or maybe they've had a problem with the motel program, or especially a lot of people we have, the isolation of a program like that isn't right for them in the moment. So maybe they need to have support around them throughout the night. And so that's kind of where we fill in.
Yeah. So you mentioned 20 during the evening, but that's not all. And I'm wondering if you can tell us the volume even during a daytime.
Yeah.
Yeah.
Totally. So, like, for example, I'll do February because that's the last month that I have the full numbers.
Sure.
So in February, we saw 140 different people come through our door, and of those, about 100 are men. So we definitely have more men that access our services. About 2/3 of the people identify as men. And then, so I actually have it broken out by the days because we kind of are operating on 3 times. We've got a day shift, an evening, and a night. So in the day, we've seen 1,069 visits. In the evening, 973 visits. And then at night, in total, 628 people have come. Or had a visit. So that means that out of the 140 people, they came 628 times at night.
Wow. Did this surprise you?
Yes and no. I think that people's ability to be resilient and self-resolve is always amazing, and it makes me happy to know how hard people are always trying to get out of a situation like needing to stay here. But unfortunately, I think that it was predictable, and I'm feeling grateful that we haven't been really pushing above our capacity limit because we're quite close to it. And so I worry that it's not probably sustainable moving forward, especially because we don't really believe that people should have to just have a resting place rather than a bed. And as we're on HealthLink, I'm sure we could get into talk about all the health impacts of not being able to have a good night's sleep every night, not being able to put your feet up and always being in an upright position like that. It really impacts the body when you do that for months and months. And so we really would like to see hopefully a different model of this come next winter. But we'll have to see.
Yeah. And certainly, I mean, you can only go without a full night's sleep, a good night's sleep, very little time, and then you are exhausted, which means in turn, you are not able to fight off any other nasty viruses or anything else that all of us can catch. And that puts everyone, obviously, it's just not healthy.
Certainly, and also the impact on somebody's mental health if they're not able to sleep, and how that compounds into if you're already carrying a really heavy mental load, not being able to get that good night's sleep at night it can really lead to a lot of trouble.
Yeah. So the surprise where you're glad to see the resilience, the numbers you had anticipated. From the time you first started to now, how has the program changed or modified, or has it?
Yeah, well, I think that in some ways it's the same spirit, and I wasn't here in 2007 when Safe and Sound started, but I hope that we have some of the same spirit of those early days about just trying to support people in whatever way they need to be met in that moment. But I think also in the last year, we have really expanded the types of support that we can offer people, and especially with the hours, but also just with even the way we're able to hand out more clothing and shoes. Now we hand out about 4 garbage bags worth of clothing in a day. That's hung up on our racks and washed for everybody, and shoes. So that's a pretty sizable program just in itself to have that many people coming in and accessing things and to get all those clothes washed and ready and put out, it can lead to be a big job just on its own.
For sure.
Yeah.
So as of March 31st, you will close at what time in the day?
So our hours are gonna be 9 a.m. till 3 p.m.
Where are people going to go?
Yeah,
Where?
it's
Where?
yeah. It's a tough question, and it's a question that I actually would really I am looking forward, or I want to ask both the city and the county this summer about designating if there's a spot that people can't go, because we're hearing that people are uncomfortable with visible homelessness. They don't like the unpredictability of an encampment coming up in a location they don't expect it to. So how then can we better support all of our residents in making clear that here you need a spot to go, here you go. Because I know you've heard me say this before, but we have to pay for it one way or another. And and it's again just a very predictable thing. We know that we have 20 people here right now who are going to be camping outside in a matter of probably by the time this is come. And so we will try and help support them with a tent, with sleeping bags, with things that so they don't further burden our systems with, getting frostbite, getting exposure, those kinds of things. We can help try and mitigate some of that. But where do they go? And are we sending them somewhere? Are they having to go to places then that don't have proper garbage disposal, don't have anywhere to use the washroom at? And that then obviously creates tensions within the community because if people need to go, they need to go. And but we need to be able to offer them somewhere to go. And it's just it's a very predictable conflict that we're running towards right now.
I recall before the program started that there was a group of people who gathered to have a conversation around the program. Are you anticipating any kind of conversation group or drawing together of people to say, okay, this is where we are. Where do we go from here? It seemed to me you had invited a mixture of different groupings together to talk. Are you thinking that might be an approach you might use?
Yeah, I think that's a great idea. And I think also we're about to do a strategic plan as an agency. And so we're hoping to get together a similar group and really just the general public as well to try and help see what direction Safe and Sound is going moving forward. Because so we started in 2007 and our mission statement has remained the same ever since. And so it's time to, as a community, come together and make sure that we're aligned with the current needs of the community and also what our service users, which we call our participants, are telling us that they need from an agency. And I think that we can see that the need for more addictions-based services is really clear. And that's something that I think that not just Safe and Sound, but everyone in our community can think about growing into further supporting.
Yeah. Do you anticipate that those 20 or some of those 20, I mean, anyone who's driven by, they will see people there gathered. If they can't be indoors, they're there, right there beside Safe and Sound. Do you anticipate that will still continue, that you will still see people want to at least be there?
Yeah, I think so. And I think that it's somewhere that people feel safe. And so they know that if they get into a conflict, they know if they have a medical emergency, that at least, for some of the time before we're open and some of the time after, there'll be someone in the building who will know what to do to help support them. And I think it is just at times a lack of feeling welcome other places. And so that makes it a lot more visible right out in front of our establishment, maybe than some others. But the same thing happens right now. We close every day at noon for lunch. And at noon, people tend to, some people go down to O'Share, but lots of people find it's best for them to stay close. So it is a public area, and so it's not it's not in our jurisdiction for sure if people are on the sidewalk or not. But we just hope that everybody can, wherever they are, make them feel like they're an equal community member.
So before we go on, because I do have some more questions, what would you ask of the community on how they can help? Because obviously you mentioned tents, and what other things can the community do to help? Because these services do cost money to run, but there's also very specific needs that would help you.
So pretty much in all the ways that somebody can give, we have a need. So whether that be financially, of course, that's a big ask for us always. We also publish a list every month of what our most critical needs are. And that can be found by going to Safe and Sound's Facebook page, or also our new website, safeandsoundgraybruce.ca. And that's safe with the letter N rather than and sound. It's a bit hard to pick that up, but anyway, Safe and Sound Grey Bruce and .ca. And so those are great places to go to actually see those needs lists. And also there's the opportunity for people to see different points of advocacy that we're calling on, and community voices to join. So right now we have the federal budget coming up soon. And so with that comes along calls for hopefully increased funding at the federal level that will eventually make its way to us. To try and support our programming. So there's a lot of different political engagements also that people can get involved with, and that probably the best place to check is there, and to just continue to educate yourself, because we all have different spheres and environments and places that we have influence in, and it's really just about looking at those spaces and seeing what we can do. And for some people, that sphere of influence is a lot bigger. And for some people, it's pretty set in your family and your friends, and talking about it and vocalizing support. So I'd say just look where you are and see what you can do with where you are.
And that's important, because whether you have lots of influence or little influence, we can all do something.
Totally. And if advocating with the federal government about the housing budget sounds like totally not something you're excited is okay, but maybe you can talk to your kids about what can lead to someone being homeless, and helping them understand what impact, like maybe somebody in their class family is going through struggles, and helping them understand that better.
Yeah. So as we sit here, you're not convinced yet that there will be funding for a program next year.
Yeah.
Sorry, go ahead. If there was, so I'm always optimistic that recognizing the need in our community and the importance of putting a roof over people's heads for months until they find more permanent housing. If you were to run the program again, what changes would you make, if any?
Well, great question. And we are optimistic and are feeling good that the program will continue, but it's whether or not there's enough money. And there's definitely, I think, a want for it to continue by all parties, but whether or not we can, it's fiscally possible is maybe another conversation. But as for, I think that what this taught us is that we do need a space for people to lay down. And one small thing that you might not think about from the outside is people's belongings. And when people are coming into our space, they're coming with everything. It's their whole life. And that accumulation of belongings over a whole winter has been a big challenge for us as an agency. And so I think that having a place for people to go at night that's set And it doesn't have to be somewhere that they stay all day like a typical shelter. But even if we can just start with just an emergency overnight spot with cots where people can go in, and that would really help all of their wellness. And I think also us as an agency, it would be a lot easier to operate than how it happened this winter.
And when you say all of their belongings, you're talking basics, right?
Totally. And
Not
even their pets.
TVs, and you're not
No.
talking blankets. Yeah.
Yeah, it's people's clothes mostly, or sometimes it's people's picture albums and those kinds of things too. But generally speaking, it's mostly just people's clothing that they are wearing as they're here. But it's tough to can't have everyone have a dresser, unfortunately.
So from what I'm hearing you say, Safe and Sound is running services and programs, but there is a need for people to have a place to lie down, which may or may not be physically right where you are. Am I understanding that correct?
Definitely. Yeah.
Okay.
So I think that's something that we're not done yet. So this is just initial observations, and we'll have a chance as a community for us to report back more fully and have a conversation. So if it has to happen, that the only way that people cannot be outside is the same way again as we've done this year, we'll do it. But I think that we need to make clear and agitate that this isn't really what we see as a dignified place for people to be.
One of the things that I think may be a benefit, words are important, stories are important, but to actually visually be present says more than anything. And you talk about those who make the decisions and make the policies and hold the dollars. Would it be helpful for them to come and observe and to see? Because sometimes that can make an impact, and to spend the time and talk to the participants.
Definitely.
How can we get those who have the levers of power and influence to come to your place?
Yeah, that's funny you say that. You must have been, did you bug my laptop? I just finished today a letter inviting Cal actually to come and visit to do a tour. So
honestly, this was not a plant.
That was such a plan. How'd you know that? But yeah, we did have, so of course we're really lucky to have you come in quite frequently to help and but also we just had last week the council from Georgian Bluff, the mayor and a couple councillors came through. So that was great. And so we're going to extend that invitation out to, both Owen Sound City Council, but also all of the other regional municipalities, because I think it is the kind of place that does seem very scary and intimidating from the outside. And for somebody who's never been in an environment like this, it can seem like a lot. But once you get in and you are able to humanize the people in it and understand that they're not some mystery kind of things, then it becomes a lot more comfortable, and it can be a fun place even to be.
I'm not going to ask what they said because I want, but I think it was great and that they took that. I'm assuming they took the initiative.
Yeah. Oh, totally. Yeah. And what they said was very positive, but we felt very supported by them. So it was fantastic. Yeah.
And I think that's amazing that they would take that initiative and reach out, and great that they saw. So, and certainly to invite others in, like sometimes, inviting in is really, really helpful. And offers that opportunity as well to make it real. And to make some of the challenges. So we've got about 4 more minutes in the program. How are tell me about the staff, because obviously this was an experience, a different kind of experience than what they've been used to. What did you hear from the staff, and what sort of opportunities or challenges did they face?
Well, I think that we were really, really lucky to have such an amazing staff group this winter, and so we went from about 5 or 6 or 7 people previously to expanding up to, I think at one point we almost had 20 people. So we really had a massive upscaling, which was really exciting, and it brought a lot of new energy and experience into the agency. And it's just hard now that since we're going back down to reduced hours, unfortunately, we're not able to retain all of those staff. So that's another challenge that now, just kind of as people have been in their roles for 5 months, if they're not continuing, that's a lot of investment we've put in that staff, and they've also put in the space and the relationships with people here that now kind of stop. And maybe we'll be able to rehire some of them again next winter, but that disruption is tough. So I think that another thing that staff is maybe it happened more for the frontline staff, because we were open when I and the manager Tom and I were here, is there certainly have been some public concerns that are brought forward, and that's a lot challenging for frontline staff to sometimes need to manage, because they themselves, I'm not sure if you can hear that, are just trying to help support people through some of their worst days. And we can't be responsible for everyone's actions, and especially if they're not happening in our space. And so I think that weighs on staff to be called upon, and for people's behaviors that really are not the staff's fault, and we can't carry that burden. Yeah.
Understanding the boundaries of what's within your scope and what is within your responsibility versus, what isn't, like you say, on the street, the public streets in your building.
Yeah.
Right. And it certainly is different. In the last minute and a half, what would you like to share with the community, or what would you like to share that I haven't thought to ask you about, Annette?
Well, thank you for having me again. And I always look forward to our chats, and also to Rogers for all of the continued support. It's fantastic. Mark's the best. And I think that I just would encourage folks to go to our website. So that's safeandsoundgraybruce.ca, and also check out our Facebook page if that's your jam instead. And reach out. We've got a lot of exciting projects happening. We have a memorial garden in our backyard that we've received funding from community foundations. So work on that is going to happen this spring, and I'm sure there'll be a call out to the community to participate in helping memorialize some important people who we've lost over the years. And so that's going to happen. We also have our strategic plan coming up for people to engage with. So what if you like shoveling dirt, or if you like doing a policy, we got something for you to do.
Excellent. So lots going on. Yeah. Annette, thank you for your time. And as always, please join us again here on HealthLink, because you always have important information to share. Thank you too to our viewing audience for joining us today. Please join us again to learn more about programs, resources, and services available to you and to your family. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
With Rogers TV, you can cheer on the home team from the comfort of your living room. We'll head to the rink, the field, the court, or the pitch, so you don't have to. Tune in and cheer on your local amateur athletes on Rogers TV.
I'm Detective Graff. This is Detective Bateman.
She had access. She had means. She had motive.
We needed to win.
We're doing this my way.
Chicago brings out the very best in all of us.